Hello, guys. Welcome to the Delivery Room podcast.
The mic is on.
The room is sacred.
Let's
talk. We are back with another one.
Yes, we are. So,
how's your week?
busy. I've had a really busy week, actually. Hectic, but we're here. Wait, it's only Tuesday.
Yeah.
I just deeped it.
I don't feel like the hecticness of September that we spoke about last time is coming to an end yet.
No.
It's rolled into October.
Yeah.
We're still here.
Yeah.
Well, last week I did 5 shifts, so just come off 5 nights. So I am, disgusting. Absolutely atrocious. So I am, battered.
I
to
can
say
imagine. I feel
the
like
least.
it takes 2 weeks to recover.
Imagine 5. It takes me like 2 days to recover from a night shift. I'm not even joking.
Yeah.
Like it takes me 2 shifts. Like I feel like I'm just about like getting to the end of recovering, and I'm back tomorrow.
Nice.
It's like
Oh yeah.
So it's like
It never ending.
It's just like never ending. Oh my goodness. But yeah.
Okay. So today, what are we speaking about?
We're gonna jump straight in. We wanted to have a conversation, talk about a few pointers in the newborn side. I feel like we obviously look after newborns up until about 2 weeks.
Yeah.
It's so funny because I feel like whenever people come to me about anything, like when their children's at 6 months and they start talking to me about weaning, and I'm just I don't know. That's where I draw the line, because I do not go that far. Okay?
After 2 weeks to sign up.
Not even 2 weeks. I would say maybe like after they have before, I'll be like where they have the injection, like the 6 to 8 week checkup at the GP. I can help you with.
Yeah.
Anything after that, I'm sorry, I'm as useless.
You have to go and find the health visitor.
Yeah, like literally, once you are over, your care has been transferred to the health visitor, I ain't got a clue.
Sorry.
I literally ain't got a clue. But yeah, so just jumping a little bit about the newborns a little bit.
Yeah.
I wanted to talk about feeding because I feel like I'll be like 100% transparent. Like I feel like I used to be like quite quick. Especially like working on the wards. Obviously, this rotation has been on my ward.
Say to give a bottle.
To give a bottle.
So
I just wanted to, I used to be. I'm not gonna lie. I am gonna put my hands up and just be guilty. It's not. I wouldn't say I was like telling people to bottle feed, but whenever a mum would be like, I'm thinking to bottle feed. I've been trying breastfeeding. It's not really working. I'd be so quick to be like, here you go, have the bottle.
Yeah.
But
I feel like all of us are like that. Though. And like you said, postnatal, the chaos of it.
Chaotic.
And then if you just think, you know what, if the baby's fed, that's one less thing I have to worry about. So you kind of just do that. I feel like I'm guilty of that as well. But
and sometimes when you do see like a lady struggling to breastfeed, it is a little bit easy to just be like, here you go, like have a bottle.
Yeah.
But we don't actually think about helping them actually persevere with the breastfeeding, because breastfeeding is not a straight line, and whoever says it's a straight line is a liar. It's difficult. Very difficult. No one's gonna pretend that breastfeeding isn't difficult.
I literally always say to my ladies, like, it's your first time doing it, and it's for most people, and then it's the first time the baby's ever doing this. Like they're learning this as well. Like loads of people think you just put baby near the nipple, boom, bam, they're feeding. But I literally would say baby's never done this before. Most people, or for the primates, is your first time. But even if you've had children before, it's not always guaranteed that it's gonna be the same. So something for people to keep in mind. I would say
breastfeeding is very difficult. I think it's just all about perseverance.
100%.
You just have to keep going.
You need stamina.
You just have to keep going. You have to be consistent, and you just got to literally put your mind frame into I can do this. It's gonna be difficult. Like I said, you're not just working with yourself. You're working with a newborn too. That's potentially doing it for the first time.
And newborns are not patient people. They are
once
not
they
patient.
realize. I feel like when they first come out, I feel like a lot of babies that do breastfeed, most of them have like a really good first feed.
Yeah.
And that's very common, because a lot of the time, most of the time actually, is actually for comfort.
Yeah.
Because at that point, their hunger doesn't actually kick in.
Yeah, exactly.
It's within that 24 to like 72 hours where they like get really hungry. Obviously their stomachs are really, really tiny at that point as well. So I think they always, most of the time, they have a really good first feed, and then it comes to the next feed and they're just like
very lethargic,
like
and
they're
just out sleeping,
they're like
out
not
of
bothered.
it,
And then mums are always like, but the first feed was so good, and I'm like, yeah, I'm not shocked that it was a good first feed, because most of the time it is just a bit of comfort for them as well. Their hunger doesn't actually kick in until like the next day probably. So yeah, but like I was saying, I think I've just been like very guilty of just like given a bottle. So I really said to myself, I'm actually going to try my best and try really hard, like especially during this rotation that I had on my postnatal, to actually like get on top with the breastfeeding. Like I actually sat with one of the staff members of the breastfeeding team, and I was like, look, I was like, look, when like I obviously know the steps, obviously I'm informed, I know the steps, like what to go through, but I was like asking like different scenarios, and I was like, do you know what, like what if I do get a lady that has given a top up, let's say, before, and actually wants to go back and now breastfeed? What's the best way? What is the best way to go about it? Or someone that has absolutely no milk. Obviously the baby needs to be fed, but this lady wants to breastfeed. How do we go about it? This lady has a baby in NNU. How often is she meant to express? How
all these
how does she go about it? Do you know what I mean? And just before I want to go into that, I actually had a student that I actually did not think of this. I had a student that came to me and said, "Oh, I've seen you guys' podcast, like you guys are really doing really well." And she was like, "Do you know what? I watched your episode on Black maternity, and she was like, do you know what? The thing about you guys saying, Black people can take pain, but she's like, I've personally never heard that, but she's like, but you know what? I've personally like been guilty of and have her too." I was like, "What?" And she was like, that I just assume like all Black mums will just be so good at breastfeeding. Because
that's another
in
kind
countries,
of like stereotype.
In countries like Africa and the Caribbean, there's a high rate of breastfeeding. And she was like, I just assume every time I see a Black mum, I'm like, yeah, she'll be fine, like she won't need help. But it's like, no, that is not the case. Like breastfeeding, whether it's a higher rate in Africa, because more time they don't have a choice.
That's what I was gonna say. In like they don't have the luxury of just being able to just go down to Tesco and getting milk. That milk money is probably feeding them for the next week. So I feel like in those countries they have to, but that's why I feel like they persevere, because they have no other choice. They have to try and feed a baby, and that's the best way of doing it. But yeah, it's sad because you do kind of just think these things sometimes as well.
And you know what, I actually didn't actually properly think about that until that student brought up, and I was like, oh my gosh, kudos to you for one, actually recognizing and admitting that you have thought that before. So that really put like a thinking cap, like I put my thinking cap on. I was like, oh my gosh, like that is another assumption that might be out there, and that is another assumption that we need to now work on killing, because that is not the case. Just because you are Black, African, Caribbean does not mean that you are going to be great at breastfeeding immediately. That absolutely, yes. I just wanted to like just point that out. Like I was just like, oh my goodness,
that's a good point.
Do you know what I mean?
It's a good point.
But yeah, like you said, it's because they don't have it. Like even here, when mums are trying to breastfeed and they have formula, like I've confiscated formula before. I'm like, give it to me.
Good, because
give it to me.
I feel like
and you're gonna
breastfeed quick.
When it's there,
you have something to rely on. And you're like, you know what? If the baby doesn't feed, I will give them the bottle. But when there's no milk there, you
have no choice.
I will have to feed the baby, and you will. Like it's definitely a mind over matter. I think breastfeeding is. It's a lot of challenging yourself mentally, because it's frustrating. Obviously when you have a newborn and they're screaming at you, you're getting frustrated, you're getting worked up. So I think it's easy to think a fed baby is fine, like let's just feed the baby, just give the baby milk. Like how many times do you see people even overfeeding the baby because they just want to shut the baby up and keep the baby quiet because the baby's crying. But you have to take your time with it.
And you just see it a lot. And you do see, obviously, like some of us midwives are definitely guilty of offering the bottle way too early. And at the first sign of a woman struggling, we're like, okay, here you go, like have a bottle. But really and truly, if a woman comes to you and says, I want to breastfeed, we should try our best to make sure that, or try our best. Obviously, there's cases where it might be more difficult than we anticipate, for example, a tongue tie. like, you know, tongue-tied babies, we're hurting the mum as much as we are the baby too. So in case like that, of course, yes, let's, you know, try find an alternative. You know, we have cup feeding and stuff like that. But obviously cup feeding isn't sustainable because they can't take it home.
I was about to say, yeah.
You know, and like the same with syringe feeding.
It's not something you can safely do at home. Like there have been cases. I don't know if you heard, like, you know, we don't have them anymore, but I don't know if other trusts still do, but back in the day, the syringes had like a little cap on it, like a little clear lid, and there were cases where people forget and they push the colostrum to give to baby, and then the baby has choked on the little kid because it was tiny and clear. It's easy to forget. You're just trying to feed the baby. That's why we don't have those anymore, and also that's why they can't do it at home, because if you go buy them and you take it home and you forget, then babies are choking.
I just assumed it was just unsafe in general.
No, I mean,
never actually
it probably isn't, but that was the case I heard of, is why we don't have those anymore. Okay. That's why we have the ones that literally is just open ended.
Interesting. But yeah, like, it's not, yes, there's some situations where, you know, we might have to give a bottle, but that's like last resort, and because we have to. But yeah, so what do you think is like the hardest bit of like breastfeeding?
I think it's what we've kind of just discussed, the mental aspects of it. I think a lot of people assume breastfeeding is automatically easier just because it's coming from your breast. I think loads of people just assume like it can't be hard. You put the nipple in the mouth and then that's it. But they don't actually know. Actually, your baby needs to have a wide enough mouth and a certain amount needs to go in, and it can be painful for some people. And I think that also puts some people off breastfeeding, but that's only because you don't have the right attachment and stuff. So I think the most challenging part that I've seen for women is the mental aspect of oh my god, I thought it was going to be easy, or my sisters and my parents and my aunties have done it, why can't I do it? So then they don't persevere as much. They kind of get disheartened by the fact that they're just coming across difficulties and they give up. I think mentally that is it. But I think if you prepare yourself that it's going to be a long run, then you know that, okay, this baby's struggling this time, but we're going to keep going and keep going. That way you're not disheartened as quickly. But yeah, that's what I would say. What about you?
I think it's just trying to do that alongside learning all the other 100,000 things you have to learn being a mum, especially like a first time mum. And obviously I think the people that struggle the most are people that have preterm babies as well, because we do have mums that have preterm babies and do really, really want to breastfeed. And obviously being premature, sometimes they do lack a lot more nutrients and important vitamins that a full-term baby might have. And obviously breastfeeding is a good way of, you know, allowing those premature babies to kind of have some of the good stuff, basically. So I think, it's really challenging. Like, I'm always heartbroken watching mummies that have baby in the unit and babies not particularly breastfeeding yet, might have a feeding tube, and they're just, you know, overwhelmed and stressed. And, you know, they've cut off time, like they've had less time for their bodies to basically like develop the necessary hormones that's needed to obviously express themselves. I think just like mixing breastfeeding with everything else that you have going on is the hardest bit.
And just speaking on the premature babies, you know, sometimes mum and babies, when babies are premature and they might need a little support, they don't necessarily have the time a term mother would. I mean, sometimes you have term babies that get admitted to the NICU as well, but I think when mum and baby are separated, that becomes another barrier to breastfeeding. It makes it even more difficult, because not only may you face the normal kind of challenges with breastfeeding, but it's now you're not actually with baby's in an incubator, you're not having that constant skin to skin to develop those hormones, to tell your brain that actually we need to stimulate, we need to make some colostrum or breast milk. So I think that it makes it more difficult for the mummies that have babies in the NICU and then you because your body just doesn't have that time it needs with baby to produce the hormones to tell your brain that I need, you know, some milk. Because, you know, it's supply and demand, like breastfeeding is supply and demand. The more babies on and babies doing, then your brain knows, okay, I need to produce more. So when you're not having that constant hormone making it, then it's like start and stop almost. That's what I'm saying.
And obviously, you know, obviously us speaking about breastfeeding, it doesn't mean to say that if you decide to formula feed your baby, it's the wrong option.
No, definitely not.
Definitely, I feel like a fed baby is definitely a happy baby.
100%.
And I believe in that. But I also do believe in, you know, if you want to breastfeed, you should try your best to breastfeed. And if you want to bottle feed, then, you know, you can obviously go down that route as well. There's no, you know, fight as to what way is better. Yes, breastfeeding might have a little bit more how do I call it, positive
I mean,
attributes, you know, it is, you know, that natural bonding. It's cheaper. It's cheaper.
Also helps prevent like cancer in mum. It helps babies as well. So
it gives antibodies, you know, that helps babies fight off certain infections a little bit better.
Actually, breastfeeding your baby reduces their chances of them being obese. Yeah.
Well, mummy, thank you.
Thank you. Breastfeeding baby reduces.
But all, you know, fed babies are happy babies.
Exactly.
And that's all we love and want. So moving on to like, obviously being on the ward. Okay, cool. So you're on the ward, you're in hospital, you've just had a baby, right? You want to breastfeed, but you've got no colostrum or milk coming out at the moment. Now, this can happen. This happens, and I feel like we see it all the time. Often, it happens all the time. I mean, with, I don't know, 9 people that you're looking after, I'd say there's about 2 out of the 9 people that may. Yeah, you know what? Sometimes more. I think it just depends. That might not be producing colostrum at the moment. So us midwives are very guilty of being like, okay, you have no milk, here you go, have a bottle. But no. We shouldn't actually be doing that. Obviously, I can only speak from the trust that we work at. I'm not sure if everyone else has the pumps that, I don't know. Anyway, our trust has these really great pumps that I've always said, if I have a baby, I swear I'm going to rent it, or I'm going to find a way to buy that pump.
Having a breast pump is
but
really
that one
good.
that we have, the Medela one that we have at work, is really
quite
good.
But they're a good investment.
Yeah. So we have Medela pumps at the trust that we work at. Obviously, I can't speak on any other brand. I'm only speaking on the Medela brand because we've used it. Yeah, because we've used that. I don't know if it's the best out there, but it's the only ones that we've used at work. So yeah, so we have something called an initiate setting. We have the initiate setting, which is an amazing setting because it basically, so a normal pump would be like,
just trying to get some milk out.
We'll just be going and going. However, this setting actually mimics a newborn's mouth and does this like really slow and
like sucking,
and then it sort of speeds up and then it slows down like you normally would. It's like us when we chew. Sometimes we might chew a bit
when
fast.
You're hungry, you're just going at it.
Stop, we'll swallow, have a break. Yeah, so this setting like basically like mimics that. And so that would be the first thing that you would give a mum. Right, cool. Milk's not coming. Next step is obviously we need stimulation because that's what we need.
Gonna get things
that's
going,
how we need to get things out, to get the milk out. So obviously the normal route would be, okay, just pop the baby on. But obviously we need to produce the milk. We can't just pop the baby on and then like nothing's coming out. We need to see like what we can get, just stimulate. And this also applies to the NICU mummies as well.
Yes.
That don't have the babies with them, or they have babies that are not able to breastfeed at the moment, might have like an NG tube in or anything like that. So yeah, would stimulate and obviously see what we can get, and we'd carry on doing this. So this is what we said about breastfeeding in general. It's persistence. Like you can't start and stop. So once we start that pumping,
we want to keep going.
We just have to keep going
because what it's doing is given that feeling. It's basically tricking your brain that baby is on
your
there
breast,
and suckling, because then there's signals that tells your brain that, oh, some baby needs food. I need to produce food. It's so clever how the body works.
Honestly,
the machine is very great. Like you just said, it's so great at mimicking that newborn sucking, and it just helps to kind of tell your brain, oh, something's happening. We need to start producing some colostrum and milk to feed the baby, and then eventually with stimulation
we should see something. I think obviously what makes it difficult as well at that stage is sometimes, you know, with the stimulation stage, obviously sometimes, you know, let's say the first time you're pumping, like maybe nothing comes out as well, and then sometimes maybe we might have to consider giving a little bit of formula, but we find other ways to give it. So like, let's say for example through a cup feed, just until we can get something obviously produced. We have a lot of women that do like express beforehand as well, which is an amazing thing to do, because again, if you are in that position where your baby is in the NICU or isn't latching on well, has a tongue tie, or you haven't produced, or well at that point I think you would have produced,
baby's just having a hard time attaching itself on the breast,
then you have that as a backup. So it's really great. Guys, I think everyone focuses on the fact that expressing colostrum can induce labor, but there's a much bigger picture to it. Like having that as a backup as well is great.
And just don't start before 37 weeks. So once you get part to that 37-week mark, then start, if you can, harvesting. Even if nothing's coming, that stimulation of the breast, it just prepares your body into that stage. So I think everyone should
I think everyone should do it, especially if you want to breastfeed.
Exactly. It is,
and even if you don't want to breastfeed, just, you know, giving your baby a little bit of the nutrients that we spoke about and all the benefits as well, without having to put your baby on the breast, as if you like, you know, if you don't, if that's not what you want to do, then you can, you know, have that colostrum and then have someone.
And then also, if you can just do that and collect the colostrum, once baby has that colostrum, you can stop before your body produces actual milk if you don't want to breastfeed. So you can just stimulate enough to get colostrum, but then stop it before it gets to a transition stage where it gets to milk. And then that way, I guess you can have best of both worlds, because baby gets the nutrients they need from the colostrum, because we call it liquid gold because it's got so many nutrients and things in it that are so beneficial for the baby. So I would say if everyone can, at least give your baby colostrum. Like even if your plan is to bottle feed, artificially feed in the long run, I think even if you give a couple of syringes of colostrum, you'll be doing your baby some good.
You really would. So I was saying, like, obviously, you know, colostrum harvesting is amazing. You can use that as a backup if, you know, you are having issues. Obviously we do get babies that are tongue tied as well, which is we can't control and we can't avoid. And obviously tongue tie babies will have a difficult time latching. Some tongue ties aren't as severe, so can still latch onto the breast and feed absolutely fine, but we do have cases where the tongue tie is quite severe, where the baby literally cannot latch on, or even when it is latched on, it's not able to stay on. It just slips off because the tongue doesn't have that set control, because it's literally limited. Like it's quite literally limited. And obviously that hurts mum, because if baby's not latching on properly, then that causes damage to the nipple. Then you have mummy that's in pain, then you have a baby that's hungry, and then we don't want that.
And just to say as well, all babies at some point should be assessed for tongue tie. It normally will be done during like their newborn examination, which all babies have before 72 hours of life in any trust across the UK. So that should be picked up, and if not, I think you always have occasional like community visits and stuff, and I feel like if it gets
but
missed,
it's usually picked up when you have a baby that's not feeding. You see a mum with a damaged nipple, for example, or cracked nipple, sore nipple, and it's very uncommon for women
literally like curling their toes when the baby's feeding, and it's like
that shouldn't be the case. Breastfeeding is not meant to hurt. It may feel uncomfortable. Sometimes it is pinchy in the beginning, and then that pinchy feeling should sort of subside. Like you shouldn't be in pain the whole way, the whole time you're breastfeeding. So tongue ties are usually picked up quite quickly anyways, because when you see a baby that's not feeding, then you start sort of narrowing down, okay, the first thing you look is tongue tie. Is this baby, or when you're observing the latch and you can see the latch isn't great, you start observing from there straight away and start thinking, okay, cool, maybe this baby has a tongue tie. So pretty much the tongue ties are picked up quite quickly. I think the ones that aren't as severe are the ones that are likely to be picked up on the NIPE, because if they're feeding well and they're latched on, then it's like, yeah, you have no reason to think the baby has a tongue tie, and then it might be discovered, you know, down the line. And obviously our trust has tongue tie clinics, but our tongue tie clinic referrals are quite long. I think it's about 2 weeks.
Yeah, and I think it's just the NHS in general.
Yeah,
but it's so easy to get.
Private is usually the way that everyone goes, and 2 weeks sounds like a small time, but when you're a baby that needs to be fed every couple of hours, every single day,
2 weeks is a long time.
Yeah, 2 weeks.
And I don't think it's too expensive to get privately, and like they can literally come the next day and just have it done.
And you have people that are actually cut tongue ties and are actually lactation consultants as well. So you get like 2 in 1. So they can literally snip the tongue tie and then actually like help
you. Yeah.
So that's actually good.
And feeding obviously is very important, and we've kind of like touched on that and why it's important. But another thing feeding is really good for as well is helping to clear jaundice in babies. Feeding is very, very important. So 6 out of 10 babies born are found to have jaundice at some point in the newborn stage. So obviously that's more than half. That's quite a big number. So feeding is one of the ways.
You see it as well.
Yeah, you do see it. Feeding is one of the ways to help kind of reduce it. The more they feed, they kind of flush it out the system with the wees and the poos. So feeding, obviously you want a fed baby, but also you don't want your baby to develop jaundice.
Before we actually get into jaundice, there's a little issue we have with our black babies. So I think we are generally always taught, okay, cool, jaundice in the skin, like if the baby's skin is yellow, like universally, but then that's what everyone thinks, yellow. But then you have a black baby who is filled with gorgeous melanin. You are not gonna look at that baby and think, okay, cool, this baby's yellow. So when assessing a black baby, we don't just look at the skin. You look at the eyes, you look at the palms of the baby's hand as well, and actually the tongue. I think that with black babies, the eyes and the tongue, I'd say, is the
most prominent
way that the jaundice would appear. And also when you are assessing a black baby, the lighting also does matter as well. I think a sufficient amount of light, like under a resus, is obviously the best way.
Or natural lighting
as well. When you're in the dark under the bay and you got a little lamp there, that's not the best way to assess a black baby. And the reason why I'm saying a black baby specifically is because with a white baby, it's going to be more prominent. When their skin turns yellow, you're going to be able to see it quite quickly. But with a black baby, no, you actually need to take that baby to, you know, a place that has a sufficient amount of lighting, like a resuscitator, or like you said, natural lighting, to actually properly analyze this baby. And a lot of the time, this is the reason why there is an increased level of jaundice in black babies, because a lot of black babies are sent home because they're jaundice, but it's not being picked up. Obviously, we do have a bilirubin flash machine that obviously tells us if a baby is jaundice. However, we don't do that until day 3, which is when the baby is already home most of the time. If the baby's in hospital, obviously we do it. A black baby, like we said, yellow skin or the yellowing of the skin is not going to be prominent.
No.
So, and a lot of the time, jaundice doesn't actually appear on day 1 as well. For some babies, yes, premature babies especially as well, but it doesn't always appear on day 1. A lot of the time, it's from day 3 to day 5, which is when it actually is shown to peak. So I
was just gonna say, like, I think obviously the knowledge, I feel like now it's people are trying, but I think the knowledge on it is very we lack knowledge in it, basically, because like you said, when you've got a melanin baby, you're not always going to see. And also, like, when I was younger, people used to call me yellow because of the way my skin was. But if you have a newborn and they're just light skinned, they look yellow, it's so easy to just kind of brush it off and think that's just their skin color, which is why it's so important to, like you said, look at the whites. The whites of the eyes will always tell you, like, when in doubt, just look at that. And the tongue. It's actually really sad, actually, because only about 10% of black babies are actually picked up when it comes to
but this is what
jaundice.
I'm saying.
And 10% compared to having 6 and 10, 60% of babies are born with have jaundice.
That's
and only about
a huge amount. It sounds small, but compared to the actual rates and statistics, that's a huge amount.
It's a massive amount. And I think we just miss it. And it's just, people just dismiss it. And it's so sad because when you're assessing a baby, you just look, oh yeah, the skin is not yellow, it's fine. And also sometimes it's like the chest area that you would see. It's not necessarily the baby's arms and feet that's going to tell you they have jaundice. You need to expose their chest and have a proper look. And everything Claudia said, have good lighting and stuff. Yeah, it's really sad that such big thing leading to deaths and there's
brain damage.
Only 10% is actually found and treated. It's just sad.
And I also think another contributing factor to that percentage is that we are so focused on if the baby turns yellow, but it's like, no, there is actually other, if your baby's lethargic, sleepy, is not waking up for feeds, not passing urine as much, because like you said, the way they get rid of this jaundice is by passing urine and opening their bowels. That gets rid of the bilirubin, which is why we're so on the go with feeding. However, if you see a baby isn't passing much urine or opening their bowels as much, then that bilirubin is building up actually even more, which could then lead to them actually becoming lethargic and not waking up for feeds. So there's that other side of assessments that we need to actually explore to actually pick up that a baby might be jaundice. It's all good and well having all these gadgets that can tell us, but sometimes we use the gadgets too late. Like I said, on day 3, that is when we actually use it, and day 5 we won't use it on day 1 or day 2 unless we can visibly see that a baby is jaundice. But there's other signs that can show us, okay, maybe this baby is developing a little bit of jaundice. Especially, let's go back to the black babies that don't always show, obviously, color. It could be lethargic and, we're just ignoring that. But it's like, no, we need to actually get on the ball and actually explore that black babies, and the jaundice shows up differently in them. I was gonna say something. I forgot. So we have that. Obviously, again, it goes back to the feeding and why we're so on the ball. Obviously, the first treatment that we usually turn to is phototherapy. But like when a baby is known to have jaundice or signs of jaundice, feeding is key. On the ball. One thing I will say though, if you choose to breastfeed your baby, you cannot overfeed a breastfed baby. You can't overfeed a breastfed baby. So be on the ball. As soon as they're showing you signs, be on it. If they don't show you signs, don't let that baby go more than 3 hours. Feed the baby. Just be on the ball with it. Obviously, if you choose to bottle feed, then also just make sure that you're feeding baby. You can overfeed a baby with bottle feeding because it's heavier on their stomachs. So make sure you're sticking to the timings and you're not feeding baby every hour or so. But you were going to say something? Yeah, I was going to say that in terms of the breastfeeding, I feel like jaundice and babies developing jaundice is also another contributing factor as to why a lot of breastfeed mums would then be tempted to bottle. Because I'm not gonna lie, as soon as you do get a baby jaundice, the pediatrician will come and be like, top up, and then the top up will be like 50 mils. I'm like,
how is that baby gonna breastfeed?
Like, and that gets on my nerves when they be saying that, give the baby a top up of 40 to 50 mils top up. That's not a top up, that's a whole feed. For a newborn baby, literally. That's not a top up. A top up, I would say, is like 10, 15 to 20 mils.
Especially if they're
But once you are going above the 20 mils, that's a feed, brother. That is not a top up. Like, but yes, I do understand that there's that urgent need to flush out the bilirubin. So we think yes, but like we said, we can tell mums express your milk and then give a top up that way as well. So there's other ways. You don't always have to jump to a bottle.
Need to be a bit patient with mums, because I think they tell mum, oh yeah, mum, you can express, and then for example, if the baby's in the NICU, by the time the mum expresses and get there, they've already given that baby a bottle, and then the mum kind of gets this hand and is like, well, at least the baby's fed, and you know, I think we give up too easily. We do
give up too easily, and I think it's also a case of us not properly
knowing,
not even properly known, not even just properly informing. Like obviously we always give the basic like feed every 3 hours, but no, like I know on the postnatal ward, like there's not always that time, but sometimes just making an individualized feeding plan with your ladies, like when they tell you they want to breastfeed, like let's make a plan, let's go with it. Do you know what I mean? Like just especially with our first time mums, not saying that second time mums won't have, third time mums won't have struggles, but they're less likely to have struggles than a first time mum. Yeah. So it's like, you know, let's just actually make individualized plans and try, you know, let's, you know, speak to the peds over on like NICU or the nurses over there. Like, you know, like you said, sometimes they are quick to just stick a bottle in because mum didn't produce, but it's like, let's give it time. Like, let's see what we can do. Yes, I know there's some cases where we might not have that time because baby might be quite more poorly and you know but when let's make a space where we can make space, you know what I mean?
And also like mummies and out there, just be very involved in the care plan. It's all so much for listening and agreeing to whatever care they've given you, but put your own input into it and making the together, like merging together to make the best care plan for your child. Like if you do want to breastfeed, don't give up because they've said baby needs 50 mils and you're like, oh, but I don't know if I can measure put that baby on your seat, get a pump, you know, all these things. So I think we're very quick to agree. We're there, but we're just agreeing, we're following. But like actually merge yourself into it and make the plan together.
Yeah, that's what I'm saying. So like stand on your ground. Like I said, we are guilty of sometimes offering a bottle. Have that option, you know. Do your own research as well. Like when the midwife says, oh, you got no milk, give the baby a bottle. No, actually, can I have a syringe? Can I try and hand express? Can I have a Medela pump? Can I try and use the initiate setting to give stimulation? Bring your own options as well, because sometimes we do, especially on the postnatal ward, sometimes you do have like more than 4 people that, you know, have with babies that are poor feeding and you're like stretched thin, and sometimes you are guilty of just being like, just give a bottle, you just have the bottle. Do you know what I mean? So like sometimes mummies, do your own research and come to us and be like, actually I heard that we can use this pump. Like I said, I'm trying my best to give out the options that can still can still allow these mums to breastfeed if they want to breastfeed. However, like sometimes woman, you know, you got to be on the ball too and be like, actually no, I want to try this. I don't want to breastfeed.
Your voice heard.
You know,
I agree. But jaundice is obviously a big thing in neonatal, and it's good to it's good to keep an eye on it, make sure you know the signs to look out for, and feed. So another thing with newborns, I think we're touching like the major topics when it comes to newborns, and I think another thing that actually had a bit of controversy online not too long ago, TikTok as always, is vitamin K.
Now vitamin K,
TikTok mummies
I don't think a lot of people are gonna like what I have to say about vitamin K, because I will always recommend vitamin K. I will never tell a lady or a woman or a father to not give their baby vitamin K. Obviously, the choice is always yours. One thing about me, I'm going to tell you to get that vitamin K.
But I think there's a lack of information out there, or people are not researching enough, because the mummies on TikTok are focused on, but why does my baby need to be injected? You know, they're just newborn. And I'm like, the bigger picture, like vitamin K, we all have it in our bodies, in our system. Babies are born with a deficiency of vitamin K. What it does is it helps the blood to clot. So it helps clot. It helps prevent internal bleeding. If any of us are in pain, I can say, I don't feel well today. If a baby is in pain, they can't tell you. they will cry, but you don't know if that cry is feeding. They're dirty nappy. They're just unhappy. They're just crying. So it's just to help prevent. It's not saying that it's 100% bulletproof. And if you give your baby vitamin K, they're never gonna have internal bleeding or any sort of bleeding. However, it is a prevention that can save a life. Like it's so like I get so angry when people online are talking about it, and they're like, vitamin K is a lifesaver, quite literally.
So yeah, like obviously, like Olivia said, obviously babies are, when they're born, they get a lot, well, when they're when they're inside mummies, they get a lot of nutrients, vitamins, oxygen that is passed through the placenta. They get a lot of vitamin. They get very little vitamin K passed through the placenta actually, which is why we offer it in the first place. So vitamin K is something that we all have in our bodies that helps our blood to clot. When you cut yourself, and then you see, yes, you might bleed a little bit, and then eventually it scabs and it dries.
Or when we tell you put pressure on it, and then it
goes. That's your blood clotting. Bubbas do not have that. So, and the reason why we offer this, and we offer this quite literally straight after birth, because I know like some people are like, oh, but they just wanted to take the baby and they give them. The reason why we try to offer it and try to give it as quickly as we can, because this baby has been squashed. And squashed.
They go through birth
and
traumas.
Squashed through labor. Like there's trauma that this baby can encounter on its way out, which can cause internal bleeding, which is why we offer that vitamin K shot, again, to prevent that bleeding. If your baby internally bleeds, the first place it's going to go
is to the brain.
It's up here.
And then you have an hypoxic baby, and the statistic with that is not great.
Not great. Survival rates for hypoxic babies aren't great.
Right.
So we give this vitamin K shot in order to try and avoid this. And I think there was a controversy about it having like dangerous chemicals in it. Vitamin K, I think people need to understand, vitamin K is not like when you go for like a BCG vaccine or like a whooping cough and all the other. I'm not specific to all like the vaccines that, or like a COVID vaccine. It's it's literally a vitamin shot. It's literally a vitamin shot. So, people are, worried about mercury in it. That I've tried. I have not seen one research that's literally solid in vitamin K has mercury in it. And I think there was a case where vitamin K was said that it causes leukemia. They were saying that there's a connection. Guys, that study has been debunked. And the case study was so small. It's not even a massive research. I can't remember who it was by, but it's such a small, and it's been debunked multiple times.
Time after time.
Time after time.
I don't think you can speak to any midwife, neonatal nurse, or pediatrician that will tell you against vitamin K. And I remember there was a American or Canadian doctor online. Don't know if you remember.
Oh, that came with she came with the scan and everything.
And I was like, yes, because people need to know how important it is. And there's even an option, if you don't want to give it as an injection, there's an option to have it orally. It's 3 doses and it's over a long period of time. However, if that is what you are really worried about, we will give orally 1 dose when they're born, and then 7 days, and then is it a month after?
I think so, yeah.
We give that many times because obviously orally babies spit up and we don't know how much they're actually taking in. But we can at least say that we've given it, we're trying. But to flat out decline it and then months along the line, it might not be something that happened initially or in the first 6 weeks. Your baby could be 8 months old and something's happened and you're wondering why, and it will be bleeding because baby didn't have vitamin K. It takes a while for their bodies to produce it.
Yeah.
Naturally,
and then this is the thing,
why we are offering it.
I feel like there are like cases where we do offer things like vitamin K and then something happens down the line and then parents turn around and say, well, I didn't know that the baby could have brain damage. So I feel like a lot of people are scared or afraid to say this could lead to death. I'm never. Because when something bad does happen, I will not have anyone turn around to me and say, well, I didn't know that this could happen. So even if I have to speak in a manner where I say baby could potentially die from this, I will make sure mum knows.
Exactly.
Because it happens. I've seen a court case that has happened where a baby did have brain damage later on down the line, and when they did the investigations, they said there was lack of vitamin K. So the baby suffered trauma from the delivery and was not able to clot the blood, so the blood traveled to the brain and the baby had brain damage. And the parents won the case because the midwife did not tell them that could happen.
It's crazy.
And this is why I always say,
you have to
I'm going to tell you.
Lay it out.
I will.
Because if it's not going to scare you into giving vitamin K, at least you know
it's not
you're
even
informed.
just to scare you. It's to inform you, to tell you that this is what can happen. You can do whatever you like with your baby.
But you can't turn around in 2 years' time and say, this is your fault because you didn't tell me.
And it happens a lot. A lot of times they do turn around and say, but you didn't tell me.
Yeah.
I will say. So, yeah. And another thing... Another reason why we'd also recommend vitamin K, especially with mummies that want to breastfeed as well, I would say, because if you do have a baby that's tongue-tied, your baby can't get the snip if it hasn't had vitamin K, because there's that risk. It's just going to bleed and bleed. That scar is never going to heal. Those muscles will not come back together and the baby will not stop bleeding because the blood will not clot because it doesn't have enough vitamin K. So if you do not have vitamin K, you can't get your tongue tie snipped.
Which is a shame because you want to do that.
Yeah, so that's another reason why I'd recommend just giving vitamin K.
I think everyone should do their research on it. The overall picture, the pros definitely outweighs the cons for vitamin K, if there are even any cons. But I think before you open your mouth and you say no, I think you should be. I mean, our trust, we're very good at. We'll speak to you. We'll get the pediatricians to speak to you. We get sometimes even the consultant to speak to you. Because we want to make sure that you are aware of all these risks. But I think everyone, a part of doing your homework, do your research about vitamin K. You have carried this baby for 9 to 10 months. You've gone through a hard delivery. You do not want something bad to happen down the line because you simply didn't want your baby to be injected or decline vitamin K without knowing, the full facts and the information behind it.
Yeah, and I think some people argue that... formula has vitamin K, but it's literally the tiniest amount. It's not even the amount that the baby would need in order to save a baby's life, essentially. Not even more than enough. But in terms of vitamin K, that I'm such a go for it. Obviously at the end of the day, it's actually your decision. However, and I also do feel like if you do not want to give your baby vitamin K, that's absolutely fine. But I don't think it's dangerous for women to come online. Oh, my belly's gonna rumble. This needs to be cut out. Okay.
I didn't. Oh, okay.
Okay.
I heard it now.
So it's dangerous for women to come online and spread misinformation. Because like I said, a lot of these case studies that do come out about it having mercury and, its relation to leukemia and things like that, they're very small case studies that have been debunked multiple times. So coming online and trying to scaremonger people and mums into not giving their vitamin K, if that's what you want to do, that is absolutely okay.
Fine,
and I think keep that just influencing others to not have vitamin K, I just think is so dangerous. It's selfish and it's dangerous. I think allow women to make the decision on their own. Do not tell a woman that their baby is going to have leukemia if they have vitamin K.
Agreed. But that was good. I think this brings us to the end of this episode.
Yes.
This was focused on the three main
big
things when it comes to newborn babies. We hope you guys have learned something. You take away something as always. Subscribe and follow us on YouTube, Spotify, TikTok, Instagram, other social medias.
And we will see you in the next episode. Bye.